Well,
Okay.
welcome to this to this session, Square, and then nice to meet you. So before we start, could you briefly introduce yourself and your work?
Okay. Thank you very much for invitation, Professor Ma. I have to say professor now, not doctor anymore. Um, my name is Huang, and I have a PhD in developmental psychology. During my PhD time, my research topic mostly focused on the mental health, well-being, and the social environment, and the mental health or the well-being. But there is very interesting thing. At the last year of my PhD, there is a generative AI chatbot started to say hello to us, which is a ChatGPT. And as we observed, we see that it brings a lot of changes to us. So now my research topic started to shift from the relationship between the social environment and mental health well-being to the generative AI and the individual's mental health, or let's say the well-being. Yeah.
I see.
By the
No,
way, I'm also a licensed. Oh, sorry. By the way, I'm also a licensed psychotherapist.
okay, that's
Yeah.
very good to know. Okay, so my next question is is to ask you, what do you think about AI? Can AI help to reduce stress or burnout? If so, how?
I think it really depends on the group. I mean, the what's the features of the population. For example, if someone has a difficulties to get access to the traditional psychotherapy, probably generative AI could be a good resources to help the mental health issues. But for some people, especially for the some, let's say, the workaholic, which is very widely seen in academia. We see that, yeah, generative AI, of course, it can help us to, to improve the work efficiency. So probably it gives us a kind of delusions that with this kind of useful tools, we can compete with a lot of people. So
Mm.
that would cause a lot of scholars put more and more time into the work, and the workaholic symptom could be more and more severe. So that could, to increase the burnout or the working stress. So it really depend. It really depends on the people. So
Mm.
and it depends on how you use the generative AI. Yeah, that is my opinion.
Yeah, you have make some very good points. Thank you. So the next question is that have you seen any examples where AI is making like a positive difference? Yeah.
Yeah, of course. I think probably you have already read a lot of, the systematic reviews works and the meta-analysis works. We can see that uh, if we develop a good product, we combine a large language model and a very professional clinic psychology knowledge, and based on that, we develop a very good tool, and that can improve the level of the mental health. But we should pay attention to one issue, that this kind of paper, they usually you focused on the participants who are the university students, and they are, which means they're young people. They're very familiar with the digital tools. They have a very good digital knowledges. But how about the other people? So how about the people, just we said, how about the people with the workaholic? How about people, let's say the elders, and how about the people lack of the digital knowledges? So that could be a problem. But of course, we can see some positive examples. You've already seen a lot of literacies, um, a lot of scientific evidence, uh, but we should also see that there are some limitations of this kind of research works. Yeah.
Yeah, thank you for your sharing now. Like I have learned a lot from what you said just now. So following so no so my next question is that so which groups might benefit most from AI supported well-being based on what you have said just now? I think you have covered some of these as well. Yeah.
Yeah. Can I share my screen a little bit?
Oh yes, yes, yes. I mean, like,
Yeah. Because last week I did a
mm,
research.
mm.
Uh, let's see if I can. Yeah.
Yeah, I can see from here. Yep.
Yep.
Mm,
Actually, this theoretic framework is generated by the let's say the GPT, but
mm,
it's not the easy work. Just to use to tell GPT, okay, you can do this for me. Actually, I designed a pipeline to
mm,
do a rapid review and may with the help of a GPT, I draw this knowledge graph very quickly in a very short time. And I try to interpret the knowledge graph a little bit, and then I draw this picture. So it's not the, let's say, it's not the automatically generalized by the GPT. It's also, I
mm,
supervise it a lot. So from this image, you can say that, so we can see this one. Oh, sorry. So we can see this one. It's users individual features.
mm,
So we try to look into some evidences, and we found that for some users who already have the mental health risks, for example, who has already very severe depression or anxiety, and especially for someone lack of the social support, or have the insecure attachment, and with the low AI literacy and the impaired reality testing. So this kind of users feel more risks to use the generative AI. That could cause, let's say, the outcome. Uh, it will, for example, it will cause them to develop the emotional dependency on the generative AI. So which means I attached it to an AI, not really attached it to a people. Uh,
mm.
yeah. So that could be a risk. So which means I live in the virtual world, not living in the reality.
Yep.
And yeah, and then that could cause some users to spend more and more time in the offline world. So and reduce the help seeking behaviors. So I think so. The generative AI is enough for me to solve my problems. So probably I don't want to go to see the practitioners. I don't want to see the counselings. I think the GPT is the best partner for me ever. So there is a possibility of that, right? And
Mm,
finally, that could reduce the well-being. But for some users, let's say, if this, for example, especially for some, the mature psychotherapists, let's say. Psychotherapists are people, of course, they feel the problems in the daily life also, but they have very good knowledge of the mental health science. And also some the young therapists, they have a very good knowledge of the generative AI and other digital knowledges. So these people, they can set a very clear boundary between the generative AI and the reality. So
yeah.
for this kind of users, so they can use the ChatGPT or other chatbot to reduce the mental health, let's say, risks or the stress very efficiently. So I think it really depends on the individual's feature.
Mm. Yeah, yeah. I mean, like, so thank you for your sharing. I mean, like, yes, I think I have learned a lot as well, especially when I see this, see this figure, explaining how AI can also affect like the mental health and also like the
Mm-hmm,
well-being and also the health seeking behaviors. Yeah.
mm-hmm.
Thank you. Yep.
I think I
So
should publish this paper, submit to some journals.
yeah. I think you should. I mean, like, I feel like this is going to be a way very useful and also meaningful paper, because I can see you have done a lot of work on it. So yeah, so I look forward to see this paper being published.
Okay, thank you.
Yeah. Okay. Yeah. So would you like
Okay,
to
I will
stop
stop
sharing?
sharing.
I mean, like, yeah.
Yeah, sure.
Okay. Yeah. Yeah. And thank you for your time. For taking the time to produce like the figure. I feel like that is very powerful. To showcase your work. I mean, like, so following on what you said just now. So do you think that, I mean, like, so can AI improve access to mental health support? Yeah.
Yeah, of course. This is a very, let's say, the obvious answer.
Mm,
Yeah,
yeah.
yeah. Especially, for some people living in a rural area, someone with financial barriers. So I think it's a really, very timely access to
Mm,
support to the support.
mm,
But yeah, especially in China, I'm not sure if it's same for the other developed countries. In the developing countries, sorry. Um, in China, most of the public hospitals don't provide the psychotherapy services. So the people have to go to the private clinic. So which means the public health insurance cannot cover the payment, but it's very high. So and also some therapists that they are not qualified enough could, which means the therapy itself could cause some traumas, so which is
mm,
very harmful. But the probably you try to talk about daily life issues with ChatGPT, right? You will find that the conversation between you and the ChatGPTs are usually very gentle. So I think, let's say, despite the delusions we just talk about the traumas. ChatGPT, I think they are more gentle. So especially for some very vulnerable users, it's a very timely support, and at the same time, it will, let's say, the cause less traumas for them, I think.
Okay, I see. Yep. So having said that, so what kind of ethical issues that should we be thinking about, when, let's say, when we try to use AI for mental health, yeah.
Yeah. I think the first one is privacy. A lot of people nowadays are talking about privacy. Yeah, because we upload our, the personal informations into the cloud, into the, some virtual world. Probably we will feel like unsafe. And we don't know how the companies could use this kind of data. So the first one is privacy. Um, Probably the big companies, uh, can do some, the public speech to the uh, to us to introduce how they protect the privacy for us, so the users could feel more, let's say, the safer to use this kind of tool. I think that this is one point. And the second point is we just talk about the psychological safety, because for some users, the AI could cause more severe mental health problems. So it's very necessary for the AI system to detect the risks of the users. So it cannot just simply answer the user's questions. It should, let's say, detect the mental health status of the users as well. So I think um, this is the question I concerned most, actually. Yeah, that is two ethic problems I can think about now. And probably the third one is um, how we combine the, let's say, not only the psychotherapist but also the physicians, how we combine these professions together with the generative AI to make a safer safer AI environment. Because the generative AI, it also has the delusions of itself, right? So which means it can create the false informations to the users. Especially someone could, to upload the physical examination results PDF document to them. So ChatGPT says, "Hey, ChatGPT, please diagnose this disease for me," and probably the diagnosis could be very wrong, and the medical suggestions could be, could cause more risks. So I think, but especially we just mentioned about, but there are some people they face the barriers to get access to the professional organizations. Like probably they're living in the rural areas, or probably they don't have the money. So I think it's very necessary for the big companies to combine the intelligence of the professions and the large language model. So to, let's say, to create a better information for the users.
Mm. Yeah, yeah, yeah. I mean, like, thank you so much for you have talking about like a lot of like good ethical issues that we should consider about. Yeah.
Mhm.
So my last question. So
Yeah.
what advice would you give, let's say, to someone who would like to use AI to support their well-being and their mental health?
Okay. So this is a very tough question. Why
Yeah.
is why is it so? Because we just talk about some users are very risky, right? But and what is the most dangerous things? These users, they are facing the risks, but they don't know that at all. They don't realize it at all. So it's really hard to give the advices to them, because in the psychotherapy theory, we also say that we can only help the people who is seeking the help, right?
Yeah.
If someone, yeah, if someone cannot realize he is like uh in the like, he's in a chaotic situation, probably the first step is to give them medication. Not give the language therapy, right? So for these users, I think the advices shouldn't be given to the users. The advices should given to the companies. They should design a system which can detect the users' risks. So
Mm.
if the system detected, okay, so this users is facing the risks, facing a lot of risks, so probably we should change the conversation model. Like, for example, the conversation model could be the client and the therapist conversation model. You cannot treat these users as a normal users. So I think
Mm.
the advices should given to the and the second advice could given to, let's say, government. We just also talk about um, the risks of a lacking of the digital literacy. So it's very important for the education system to increase the students' digital literacy and AI literacy, because nowadays we cannot live without it. We have to admit that, whether you like it or not. So it's very important. I know some users. I read some cases reports. Um, a patient in New York. He reported that he feel like the GPT is like the JC is conveying or delivering the message to him. But for someone with the good knowledge, good digital knowledge, he was okay. It's just the sentences generated by the AI. So it's not the true. It's not from someone. It's not. Of course, it's not from the Jesus. So it's very important for the government to put some educational strategies. Yeah.
Mm. Yeah, yeah. I mean, like, I totally agree with what you said. I think it's very important that we are aware of the limitations of this
Yeah.
AI, tools, when we are trying to use it, let's say for our mental health and well-being, and always not. I think it's better always to ask for the professional support first.
Yeah.
No, unless if you cannot, for example, like find anyone, then maybe you can use these AI tools. But then, ideally, you should first try to get a professional support. Yeah.
Yeah,
So
yeah.
I think that's all for me. I mean, like, so do you have anything else you want to add before we close today's session? Anything else you want to add or you want to say? Yeah.
Yeah, actually, I have a questions for you.
Okay. Yes.
Yeah,
Do
yeah.
you want
So
me? Yeah, 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 yeah.
yeah.
Mm.
So the first question is, what is your opinion towards the generative AI?
You mean like my opinion towards the use
Yeah,
of generative AI? Do you
yeah.
mean for the mental health and well-being?
No, no, your general, your general
Mm.
opinions.
Like my general opinion is that maybe I think the use of AI definitely can
Mm-hmm,
help to improve people life and also well-being and also
mm-hmm,
make our work to be easier. I can see that it's definitely doing like something good, okay.
mm-hmm,
But at the same time, as you say, some populations, if they are at risk of something, let's say for example, like
mm-hmm,
having some mental health issues, or
mm-hmm,
if they have very low AI literacy, they might use it in the wrong way.
yeah.
So that maybe not it's not like a good case. So I would say that like we need to teach people okay how to use AI in a responsible way so
Mm-hmm,
that will benefit their life like yeah in a very positive way. So in general I would say that AI is going to stay. We cannot for example like, remove AI entirely from our life. It's going to stay in our life, and then we just need to think about how we're going to use it in the positive way that's going to benefit us. Yeah.
mm-hmm.
Mm.
And my second question
Mm.
is about the generative AI in education field. So,
Mm.
do you think the generative AI makes students, let's say, smarter, or that
Mm. Okay.
I couldn't say that word.
Yeah. I understand your question. So I'll say that like especially for some students, let's say if they don't have good resources, right, good
Mhm,
teaching resources, AI is definitely going to be a very good teacher for them because AI is
mhm,
going to tell them, for example, like, let's say if they ask any questions, AI can answer them, right? So I will not say that AI is going to make the students smarter, or less smarter, but I
mhm,
think AI is going to help the student to understand, for example, like the world better, to get the knowledge better, and also to see the world in the way I know in a different way, with more knowledge being given to them. Okay,
mhm,
so well, if you, I'll say that like the student is going to, like learn better, as in some ways. Okay, if you say smarter, well, I'm not really sure about it. Whether we are going to
mhm,
make the student to be smarter or less smarter because it really depends on how do we measure it. Let's say if you measure it by let's say exams or by written
mhm,
assignment, right? Let's say if you ask them, please write 1,000 word assignment. If they use AI to help them to complete the like assignment, if they get very high marks, does that mean that they are smarter?
mhm,
Than other students who are not using AI. So I think that is very hard to measure, and I think that's very hard to say. But
mhm,
in general way, I would say that AI is helping the students, especially if they're coming from very let's say poor resource setting, right? So AI is going to definitely help them a lot because that is going to
mhm.
give them like AI is going to be like one of the very good teacher, I think, to
Yeah,
give them the knowledge because let's say if they don't have resources,
yeah,
to all these things. Yeah. Mm.
yeah, yeah. It sounds very similar in psychotherapy field.
Yeah, yeah,
Yeah,
I totally agree.
yeah,
I think it just depends on how do you use AI. Yeah,
yeah,
because if you use it in a very good way, then that's going to benefit you, benefit the students, benefit like the patients. But if you use it in a not so good way, okay, and if you have a very low AI literacy, then maybe you're not going to use AI in a positive way in your life. Yeah, I think you need to know how to use it. It's just like you need to have some instructions. Okay, so this
mhm,
is how you
yeah,
use AI,
yeah.
right? Yeah. Mm.
Yeah, yeah.
Yeah.
I recently read an article, uh, a Chinese article. It tested it found that more and more Chinese students use AI to finish the assignments, but we found a decrease of the cognitive ability during this
Mm,
kind of usage. So which means, okay, so it seems like we don't want to use our brain. We just let the GPT to do the effort.
yep,
Yeah.
yep, yeah, yeah. I can see what you mean. So I think that really brings to us to ask about, let's say as a teacher, right?
Mhm.
How do you design your assignment or your assessment to make sure that the student is able to like to use higher order levels, of thinking when they try to complete their assignments. Let's say if we design this like the assignment, you just need to put the question into the chat GPT, and then chat GPT can produce the whole assignment for you. Then
Yeah.
maybe that is not a very good, good assignment that we have designed. We might need
Mm-hmm.
to think about, okay, what kind of question that we need to ask students, that student,
Uh-huh.
they need to answer that question by using their own knowledge, not with ChatGPT. Yeah.
Uh-huh.
So I think that's
Understand.
that I think there's a lot for us to think about as a teacher, and as someone who designed the assignments. Yeah. Not easy.
Yeah. So that means, so that means the teachers should use their intelligence very fully.
Yeah, yeah.
Yeah.
And also maybe they can also use ChatGPT, I mean, like at the same time, to design
Uh-huh.
an assignment, okay, that
Yeah.
ChatGPT maybe cannot answer very well.
Okay. Okay.
Right? So
I
you have to
understand.
challenge the ChatGPT to come up with
Uh-huh.
something that they cannot answer, that ChatGPT cannot answer it for the students.
Uh-huh.
So
That's
the
a good
teacher need to know how
strategy.
to, yeah. So the
Yeah,
teacher
yeah,
need to
yeah.
know how to use ChatGPT as well, to make sure that they are able to ask some very difficult question that ChatGPT will say, sorry, I don't have the answer for this. Right? Then the
Okay.
students cannot use ChatGPT to
Yeah.
write the assignments. Yeah.
Yeah, I understand. So which means you have to find the GPT's bugs first.
Yes. That's why you need
Yeah,
to
yeah, very
challenge.
interesting. Yeah, yeah,
Keep
yeah,
challenging, yeah, ChatGPT. Yeah.
yeah,
Yeah.
very
Yeah.
interesting. Thank you. Thank you very
Yeah.
much for your answers. Yeah, yeah. Thank you. Thank you
Okay,
very
so
much.
I'll
And
start
also
the
thank you
recording
very much
now.
for your
Okay.
invitation.
Yeah, yeah.
Yeah.
Okay, let me just start the recording now. Okay.
Mm-hmm.